And now you finished, bir kişi daha geldi. You finished the first class of dentistry education. And now things are getting more serious for you in your second grade. And you will learn more about basic informations of dentistry for, especially for clinical practice. I hope every one of you a great education year. And if you have any questions, anything you want to ask, please contact with us. I will share my email address at the end of the lecture with you. Are we ready for the lecture? Everybody is okay? Do you see the slides?
Yes, teacher.
Evet hocam.
Okay. Türk arkadaşlar için eğer anlamadığınız bir nokta olursa lütfen bölüp şey yapmaktan, sormaktan çekinmeyin. Ben arada gerekli yerleri Türkçe olarak da vurgulamaya çalışacağım ama dersin akışını İngilizce olarak devam ettirmeyi düşünüyorum. Başlayalım bakalım. Today's course is Material Science and with the code of DENT 213. This is a visit course and a multidisciplinary course. 3 different departments will teach you some lessons, some lectures. We are prosthodontics department and I am Dr. Elif Naz Özen. Today I'm going to give you a lecture about the dental materials' biological properties. These are the other course instructors you are going to meet soon. These are the fall and spring semester timetables for your lectures. If you have anything to ask to the lecturers, please, you can come back and look at this slide to find their name. You have, as you can see here in the left table, a midterm exam on the fall semester and also a midterm exam on spring semester, but it is not written here. But when the time is scheduled, we will let you know. After the midterm exam, you will have some other lectures also. And the aim of the course is we want to teach you about the liner-based materials, luting cements, and adhesive systems that we frequently use in our daily practice. And as a prosthodontist, you are going to also use so many restorative and prosthetic materials. So we want to teach these materials to you in this lecture, in this course, okay? You can read these objectives, attitude, and outcomes later. I will share with you the slides. I will put it in your classroom, okay, in PDF format. So assessments are important. As I said before, you will have one midterm in fall semester and one midterm in spring semester. At the end of the academic year, you will have final examination. To be attend to the final examination, you have to require an attendance limit. If you pass 20% of absence for this course through all year, you will not be able to attend a final examination and you are going to fail due to lack of attendance. So please, everybody should precisely care about the attendance and everybody should follow their own attendance to the lectures. If there's a problem in the first semester, you can contact with us, okay? These are another learning resources I'm going to tell you about this course, this lecture. And so let's start with the properties of materials. There are 4 classes of properties of materials. Today I'm going to talk about biological properties, and following 2 weeks, another lecturer is going to talk about mechanical properties and physical and other properties to you. So let's start with what is biomaterial. Biomaterial is a material that can be natural or synthetic origin and contacts with the living organisms, tissues, blood, and biological fluids and organs to treat, to augment, and to replace these tissues or organs without negatively affecting the living organisms and its components. So there are several definitions about biomaterials. You should take a look at these. And then we also use several materials in dentistry, but what should be the properties of these materials? These materials should be biologically compatible to harm the living organism, chemically inert and stable, mechanically strong enough to resist against the forces in the mouth, must have suitable weight and density, adapt to an intense life, because you may know that in the mouth there's many forces, many chemical environment changes. So this is a really intense life, and our material should resist to it. These materials must be cheap and fabricated easily in great amounts, and also these materials shouldn't be toxic and carcinogenic, and not shouldn't be mutagenic. We will see some slides later. There are 4 classes of dental biomaterials. And these are polymers, metals, ceramics, and composites. Now, let's take a look deeply into these classes. Polymer materials are composed of monomeric particles, molecules. When these monomeric molecules bind together in chains, in long repeating chains, they form polymeric materials. As you can see in the left picture, the white dots, the white spheres, I can say, is monomers, and they bind together in long chains, and they form, after a polymerization process, they form polymers. We can give an example to these polymer materials. As you can see, there's a total prosthesis. I think you are familiar to that. And the pink parts of the total prosthesis is polymethyl methacrylate material, PMMA. This polymethyl methacrylate material is a polymeric material, and methyl methacrylate is the monomer of this material. So we are going to use this polymer material in the patient's mouth. And metals are second class. Metals, as you may know, metal is an element, maybe a compound, and maybe an alloy. And metals are typically hard, opaque, shiny, and has good electrical and thermal conductivity. And as you can see in the left picture, there is an amalgam restorative material in posterior tooth. This is a metal. Amalgam contains mercury elements. And in the right picture, you see a removable partial denture, where we replace some missing teeth by removable prosthesis. And the substructure of this prosthesis is chrome cobalt metallic substructure, chrome cobalt alloy. So we use metals in the mouth very frequently. Third class is ceramics. Ceramic is an inorganic, non-metallic solid material comprising metal or non-metal atoms, primarily held in ionic and covalent bonds. So I think the most often used material in dentistry may be ceramics, especially in prosthodontics. Some example for a ceramic material may be lithium disilicate glass ceramic, but there is many more types of ceramic materials. Here you can see in the left upper picture the raw form of this lithium disilicate glass ceramic material. Then we call them ingots. You will learn later this information, but I want you to be familiar to these definitions. These ingots are pressed into molds, and then these laminate veneers, as you can see in the lower picture, are produced to cement to the patient and to enhance their aesthetic and function and psychology. Even sometimes patients are very unhappy with their smile, so we can have a very big effect on their psychology. And the third class is composites. Composite is a material made from 2 or more constituent material with different physical or chemical properties. Then when combined, produce a material with characteristics different from the individual components. Now, this is the definition, but I want briefly to tell you that. On the left lower pictures, you see some schemes. On the left one, you see that there is a matrix, there is a refill, which is particles, and there is a bonding agent. These three different type of material layers comes into together, and you see that they make a hybrid composite material. With this hybrid composite materials, there is an example that may be given. Nanohybrid composite resins. You will learn during this course later lectures. These composite materials, as you can see on the upper picture, there is a cavity on the anterior teeth, and the cavity is filled with an anterior composite material. They have a tooth-like color, so the aesthetic is very nice. And these composite materials in dentistry, we are containing them in tube-like boxes. We are protecting them. So there are the four main classes. What else can be? What else dental materials can be told? There are various materials in dentistry, as you know, and you will learn. Some examples can be given as fissure sealants, mouth guards, orthodontic appliances, veneers and bleaching materials, amalgam restorative materials, and tooth-colored composite restorative materials, root filling materials, ceramics, casting alloys, which is döküm alaşımları in Turkish, or resins, several auxiliary materials that we don't use in patient's mouth, but we use in our laboratories to produce restorations for our patients. There is a different classification of dental materials. You can check in here according to their clinical usage. It may be long-term, temporary, short-term, or very short-term. And other class is the materials that we don't use in our patient's mouth, but we use in dental technician laboratory. And why the importance about dental material, why the information about dental materials is so important for us dentists, because we frequently use them in our daily practice, in our dental clinics, in our patient's mouth. So we have to be able to choose these materials appropriately for our case, for our patients. And if we are going to design a cavity for preparation for our patients, maybe if we know our material, the preparation will be appropriate for this material. So we are very material dependent according to our preparation. And we have to be able to know the manipulation of this material, because if we don't know, how do we apply it to our patients? So the scientific principles behind the material, we should know that very deeply and precisely, because our materials are very technique sensitive, so we have to be able to manipulate and apply them with correct techniques. When we use a material in our patient's mouth, we have to consider many different questions. These questions can be like that. And how does the material affect oral tissues? Does it going to irritate our patient's mouth, or like that? How is the interaction between the biomaterial and tissue interface? Will there be any disintegrations and breakings on the material when our patients use it? How do the tissues act on the biomaterial? Is there any chemical disintegration? May the material be broken or abraded? Are there other physical properties that may be important, like thermal and optic characteristics? Especially are the aesthetic characteristics important? Especially on the anterior restorations, the aesthetics is very important for both the patient and for us. So we have to consider that the material should be optically appropriate for our final result, for our intended result. Excuse me. Yes. Is the manipulation of the material easy or there's a technical sensitivity do we need to know? Is the material cheap? And if it is not cheap, does it show a better performance when compared to a cheaper one? So the materials we are going to use in the mouth should have some characteristics, some properties, as I mentioned before. These materials should be biocompatible, which biocompatibility means that the material should not harm the oral environment. Interfacial characteristics are important. The relationship between the material and the oral tissues must be compatible with the usage exposure, such as the composite restoration shouldn't allow microleakage to lead to secondary caries. So it should be used in long term in our patient's mouth. And chemical properties are important. Oral environment, temperature changes, saliva, and the taken food should not have an unfavorable effect on our material. Mechanical and other physical properties are important. Materials shouldn't be disintegrated or demolished by oral environments, by occlusal forces. And aesthetics is important, of course, as I mentioned. And materials should be practical, as you can imagine, because we are going to use them very, very often, and we shouldn't çok fazla zaman ayırmamamız gerekiyor o materyalle uğraşmak adına, öyle söyleyebilirim arkadaşlar. Pratik olması gerekiyor. Kolay manipüle edebilir olmamız gerekiyor. Materials should be easy to manipulate. And I paid very attention on biocompatibility, if you noticed. So what is a biocompatibility? Biocompatibility can be defined as the ability of a material to elicit an appropriate biological response in a given application in the body. And the human tissues, this interaction shouldn't harm the living organism. So if material is not biocompatible, we have some issues in the mouth, we have some problems in the patient. So what can be these problems? First, irritation. Irritation is an inflammation or other discomfort in body parts caused by the reaction of an irritant substance. Dental materials, of course, shouldn't irritate the patient's tissues. More severe local and systemic toxicity. Birisi mi katılmak istedi derse? Local and systemic toxicity. Toxicity is a dose-related phenomenon, maybe you know. If any material's quantity exceeds a limit, a threshold, every material can be toxic to the human life. Local toxicity substances released from our dental material may generate a reaction when the threshold exceeded, but this reaction is limited in this adjacent tissues in the oral mucosa, such as gingiva, tongue, cheeks, bone, and pulp, etc. And these local effects are a function of the ability of substances to be distributed to this site. If the distribution increases, the local toxicity increases. And if the concentration increases, the toxicity also increases, and the exposure time increases, the local toxicity also increases. And the systemic toxicity is a more severe type of toxicity. If the dental materials or released substances distributed through the through the body, through blood circulation or through lymphatic circulation or through inhalation, it may affect all the system, all the body of the patient. And this toxicity types is more severe and dangerous. So also the duration and concentration, the excretion rate, and the site of exposure also important, and it depends on the biologic response. The concentration to cause local toxicity might be less than the concentration to cause systemic toxicity, as you can imagine. And the third problem we can face is allergy. In allergy, our body recognizes a material, a substance as foreign and reacts disproportionately to this material and generates an inflammatory response that may be very dangerous for the patient. And we shouldn't confuse the allergic reaction to toxic reaction because they are very similar in the final result, but very different to treat. In allergic reaction, it occurs independent of those. So if the patient şöyle söyleyeyim Türkçe olarak onu anlatayım tekrardan burayı okuyacağım zaten. Çok minik bir miktarına bile bir materyalin hasta maruz kaldığında alerjik bir reaksiyon gerçekleşebilirken sadece bir akriliğin değmesi bile yetebilirken bazen hastaya toksik reaksiyonda o dozun sınır dediğim dozun üzerine çıkmış olması gerekiyor. Yani toksik reaksiyonlarda küçük dozlar toksik bir sonuca yol açmazken alerjik reaksiyona yol açabiliyor. In allergic reactions, they doesn't elicit at first exposure. However, the toxic reaction, first exposure may result in toxic reaction. And allergic reactions may show variation among individuals. There is no rule for everybody to be allergic to polymethyl methacrylate, for example. But in toxic reactions, they don't differ among individuals. If the threshold is exceeded, everybody will be toxicated from a material. And the fourth problem we may face is mutagenicity. When a material's components affect the base pair sequences of DNA cells, we call it mutations, as you know. And mutations may be because of radiation, chemicals, and errors in the DNA replication process. And in dental practice, some materials that we use may be mutagenic. These are nickel, copper, beryllium, some root canal sealers, and some resin-based materials. However, it must be clear that mutagenicity doesn't imply carcinogenicity, which is tumors, because many mutations are repaired in the body by protection systems of the body, defense systems of the body, and others are irrelevant. So we should know that a dental material shouldn't be mutagenic. And the fifth problem can be carcinogenicity. After inhalation, ingestion, dermal application, or injection, carcinogenic materials induced malignant tumors, increase their incidence and malignancy, or shorten the time of tumor occurrence. So there is no current dental material which leads to any carcinogenic occurrence. And the sixth one is teratogenicity. Teratogenicity, as you can see on the can be very tragic. So because it is a material's capability of producing congenital anomalies on the new generation. When a teratogenic material affects the pregnant woman, their babies may have some anomalies. And some reasons can be alcohol, drugs, hormones, and lead and mercury. If the pregnant woman exposed to these agents, their children may have some congenital anomalies. So it affects all the other generation. It is very, very tragic and important for us to know. As you can guess, dental materials shouldn't be teratogenic. And there is a very, very bad situation, tragedy in the history. In 1957, some German scientists discovered a drug named thalidomide. This thalidomide acts as an anti-emetic against the pregnant ladies' vomiting and nausea problems. So when this drug is first found, pregnant women use them very frequently. But when their children comes into life, they see that their limbs are not well developed. So it's a very big tragedy. and the babies live a very, very tragic life, I think. So we have to be very careful what we prescribe to our patients. So there is some issues in dentistry that may be against biocompatibility rule. The first one is latex, and we use latex in our gloves and rubber dams. As you can see that the blue thing on patient's mouth is rubber dam. We isolate some teeth by this rubber dam plastic sheet from the patient's mouth. When we isolate these teeth, we can very, very protectively restore our teeth. And in our gloves, as you can see, when doctors exposed to this latex, and if they have an allergy, they may have acute dermatitis. As you can see in the right picture, some rashes and redness in the hands, and they may be exceed the hands to arms and something like other systemic effects. If a doctor or patients have some kind of allergy to latex, they shouldn't use gloves like that. They should use nitrile gloves. If maybe you can experience this acute dermatosis. So if you have anything like that, please skip to the nitrile gloves, okay? And the other material is nickel. Nickel is the most allergic material known, and we use it in our prosthetic material alloys, in crowns, fixed partial dentures, removable partial dentures, and in some orthodontic appliances. If a patient has a nickel allergy, we should maybe do some patch test on these patients to be sure about that this is the nickel causing the allergy. So we shouldn't use nickel in our alloys. And the third one is beryllium. Beryllium increasing the castability, dökülebilirlik, bizim metal parçalarımızın dökülebilirliğini arttıran bir element. Beryllium elementi ve erime ısısını düşürüyor. But the beryllium is documented as carcinogen, although there is no study that shows beryllium leads cancer in humans. However, beryllium may lead to berylliosis disease, which affects the lungs as a chronic inflammatory condition. So, especially the technicians or prosthodontists, again, may have berylliosis due to beryllium-inducing nickel-chrome alloys. If we inhale the beryllium dusts or fume during casting or grinding and polishing, we may catch the disease of berylliosis. And mercury and amalgam. This is a very, very controversial issue for several decades, I think. Is the amalgam is dangerous for health? Is the mercury is released from the amalgam to the systemic circulation? This is a very controversial issue. So I want to say that the amount that need of mercury to exceed the toxicity threshold is very, very much. So if patient has 2-3 amalgams in the mouth, it doesn't release this much to exceed this threshold to have toxic effects in our patients. However, when we remove the old amalgam restorations from our patient's mouth, from our patient's teeth, during the removal process, as you know, we use some motors, motor turbines, which which works with air and water. So during this removal process, some vapor from amalgam and some mercury vapor may be inhaled by patients or by the dentists. So we should protect our patients from this removal process first. The 3 or 4 amalgam restorations in the mouth intact, healthy, it doesn't cause any problem in our patients, but during the removal process, we should use rubber dams for our patients not to swallow, not to inhale this vapor. And we should protect ourselves with masks, of course, not to inhale this vapor, of course. Okay. And estrogenicity, this is a term that if a chemical acts as an estrogen hormone in the body, bisphenol A found guilty about the estrogenicity, and this bisphenol A material was found in bis-GMA composites. But although the estrogenicity of BPA has been confirmed, no evidence exists that dental composites have estrogenic effects in vitro or in vivo. Last is polymethyl methacrylate, as I mentioned before. Polymethyl methacrylate is composed of methyl methacrylate monomeric materials, and these monomeric materials, unpolymerized monomeric materials, may cause contact dermatitis in doctors' or patients' hands or mouth, and in very, very rare but severe cases, some patients may be allergic to polymethyl methacrylate and may undergo anaphylactic responses, which may be very dangerous for our patients. So we have to be sure that our patient doesn't have polymethyl methacrylate allergy. By patch tests, again, we can send patients to doctor to have a patch test against polymethyl methacrylate. Lead and tin, kurşun ve kalay. These materials may be found in some impression materials and may have some toxic effects. And last two slides, we are approaching the end of the lesson. Fluorosis. Fluorosis, as you may know, fluor is a very popular material in dentistry, and we have very beneficial effects of fluoride due to their its protective effect against dental caries. But if there is an overexposure of fluoride by systemically ingestion during the first 8 years of life, most permanent teeth may be affected by fluorosis disease. This fluorosis disease, as you can see, mild type, and you see that there is a white spots in the incisor teeth in this child. And if the fluorosis dose exceeds some thresholds, this fluorosis may be moderate or severe. In severe cases, this staining may be more yellowish or brownish and may affect aesthetic more badly. And there may be some pits and fissures in the enamel formation. So these teeth maybe need to have a restoration later in the life. So fluorosis should be we have to be very careful about the fluorosis during the first 8 years of life, not to take systemically more fluoride material than we need. Okay. And silica sand. We use silica sand for very different purposes in dentistry. For polishing our restorations, composite or porcelain restorations, we may use them as a coating on paper discs. We use them on patient's mouth, and in technician's office, we may use silica sand to sandblast surfaces. We should protect ourselves from inhaling this silica sand by these boxes, as you can see on the middle of the slide. Through these boxes you can see, but there's a glass layer preventing inhalation of the silica sand. So thank you for your attention. If you have anything to ask, please ask now, or please email me by my email address. I think you can see now. Is there any question? Efe, sen el kaldırdın galiba. Arkadaşlar duyuyor musunuz?
Hocam ben bir şey sorabilir miyim?
Evet.
Hocam lateks eldivenler alerji yapabilirse onun yerine hangi eldivenleri kullanabiliriz demiştiniz?
nitril eldivenler. Genelde böyle daha renkli olanlar, mavi olur onlar. Nitril glove diye geçiyor. Eğer lateks eldiven sizde de akut dermatit, alerjik dermatit yapıyorsa nitril eldivene geçmeniz gerekiyor.
Teşekkür ederim hocam.
Rica ederim. Ahmetciğim, slaytları size ne zaman ulaştırabilirim? Bu dersin sonunda slaytları PDF'e